Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Thank you very much. I know it's an odd time for all of you immediately after Iftari. बहुत गैप आ गया था इस एक्टिविटी को हमें किए हुए मुझे किए हुए. So I was thinking that I should proceed with some of the topics which were asked by various candidates. So ये पहला टॉपिक मुझे आया और मैंने सोचा कि इसको प्रेजेंट कर लेते हैं, डिस्कस कर लेते हैं. हाउ टू अटेम्प्ट द एमसीक्यू. सो बेसिकली this topic is important because all the examination workout is changed now. So now most of the examination pattern in IM and I'm hearing that even FCPS Part 2 is going to be MCQs. So उसमें से भी वो questions खत्म हो रहे हैं और वो MCQ हो जाएगा soon enough. How soon I don't know. कब notification उसका आ जाए. So if that process changes as well, तो फिर हम लोग at par हो जाएंगे with MRC Psych, USMLE and other examination where most of the questions are MCQs and mostly one best answers. Difference between US, British, and other sectors are the quality of the MCQ. So USMLE के mostly questions are scenario based. They ask big scenarios and they give you the options. So usually there a STEM is having a scenario where you have to respond according to the question in USMLE, most of it. अभी क्योंकि सीपीएसपी पहली दफा एग्जाम करा रहा है तो मुझे नहीं पता कि उसमें कितने क्वेश्चंस जो हैं वो सिनेरियो बेस्ड होंगे. As far as I remember, long time back, this was the theme कि mostly questions जो हैं वो scenario based बनाए जाएं ताकि कैंडिडेट जो है वो scenario based questions को पढ़ के और अटेम्प्ट करे. लेकिन हमारे बहुत सारे theoretical questions में कुछ questions जो थ्योरी से रिलेटेड हैं उसमें सिनेरियोज बनाने मुश्किल होते हैं. Now, again, there is one difference between US and other countries is the money. So they have lots of money. So they spend money, they get the best possible MCQs made, and then they put them in the bank. Now, CPSP, whatsoever amount they gave, of course, it's not as big a pool. So total psychiatrists in Pakistan are about 500. So even if 10 MCQs by each psychiatrist are again deposited in CPSP and they are vetted and they are cleaned up and they are formatted according to the CPSP guidelines, even then they won't be more than 4,000 MCQs in psychiatry or 5,000 MCQs, अगर सारे भी accept हो जाएं, which practically seems not possible because सारे एकेडमिक लेवल पे नहीं हैं और जो एकेडमिक लेवल पे हैं उनको फिर MCQs बनाने पड़ते हैं. वो ज़्यादातर प्रोफेसर, एसोसिएट प्रोफेसर, बिजी लोग हैं, वो कितने MCQs जमा करा सकते हैं, वो कितने अप टू द मार्क होते हैं और एक्सेप्ट हो जाते हैं एज एग्जाम टू बी पार्ट ऑफ द एग्जामिनेशन. दैट इज अगेन इफ एंड बट एज वेल. There is a big bank of MCQs in Singapore examination. So psychiatry and behavioral sciences and psychology MCQs. I was not able to successfully download those, but I am sure that they are available in Pakistan in various PDF formats and you can get it printed. So they have a huge bank of MCQs. Australian Board of Psychiatry, British Royal College of Psychiatry, USMLE, they all have. Even in Canada, यहाँ पे एक किताब मिलती है Toronto Notes. So Toronto Notes में जो psychiatry का section है उसके MCQs they are there and there are other papers as well. So I'm not very much familiar with all of those, but there are all MCQs. And these MCQs are usually one best answer. And one best answer usually is 5 options. Most of the research shows that 4 options or 5 options doesn't make much of the difference in actually assessing a candidate as a part of the examination. So 4 options or 5 options are practically the same outcome as far as the research is concerned in medical education. So even if there is a four response MCQ and you get hold of them, then you can practice them, because four attempts or five attempts, you will be at the same par. So Joe, what I'm going to present today is mostly how I am as an examiner will make an MCQ. And you have to understand as a candidate that this is how the examiner is making an MCQ, and this is how they expect you to attempt. So if we both are in alignment, then you won't have any difficulty in attempting an MCQ. But if you won't be able to understand the dynamics, how the MCQ is made, then probably you won't be able to understand how you should proceed with it. So, and I'm sure this presentation will just give you an outline how to prepare for your IMM examination. Let's hope it will help you. Okay, मुनीर न्याजी की एक गजल, बेचैन बहुत फिरना, घबराए हुए रहना, एक आग सी जज्बों की दहकाए हुए रहना, आदत ही बना ली है तुमने तो मुनीर अपनी, जिस शहर में भी रहना, उकताए हुए रहना. Whenever you want to attempt an MCQ, make sure that you're fully there with wholehearted mind and soul. And if you feel that you are exhausted, make sure that you take a break, because it's a tricky thing. So when you are reading it, sometimes straight away, of course, a bookish picture, and you know that this MCQ has this answer and you go for it. But in majority of the situation, you have to read it, assess it, analyze it, and then attempt it. And if you are not sharp, vigilant, active, then you will lose that stem and will answer to a wrong question. So if you have to attempt a question, MCQ, your activeness and active participation in reading about it is important. So how to begin in any MCQ examination, and I'm sure people have given MRC Psych Part 1 and USMLE Part 1 and Australian Board Part 1. So all of these examinations are MCQ based, and you must be knowing. So the first and foremost thing is that you have to stimulate the required behavior. And the required behavior is that your whole heart and mind should be there. So आपको उसको देखना और उसको समझना और उसको attempt करना. So this is very, very important. And again, I'm saying that if you feel tired, exhausted, not able to focus, take a break. And then come back with the intense force so that you'll be able to analyze it properly. Spaced practice is better than massed practice. So the most of the time in our examination system, in most of the examinations that we give, mass practice is basically the concept. So we sit from 8 a.m. in the morning till 8 p.m. or 10 p.m. at night, or sometimes at 8 p.m. at night till 6 a.m. in the morning, and continuous straight go 6 to 8 hours of study. That's what we do. And 6 to 8 hours of study, and then going for next day, in between just a lunch break or a dinner break or a coffee break or something like that. But mostly we go for mass practice, which is actually not recommended in majority of the examination processes where you have to attempt the MCQs. So spaced practice is always allowed. So I always ask my candidates, my trainees, that they should always have a book in their hand, always. Now, it's not the reason that I want them to show that they are carrying a book. It's because I feel that the spaced practice can be practiced only when you have a book in hand. So you are sitting in the morning, you went to the hospital, you were the first person there, you have half an hour, you open a book and you attempt a few questions. Then your routine starts for an hour or two, and then you have a break for another half an hour or so. So you start attempting 4 or 5 more questions. So if you go with the spaced practice, then it is recommended. And psychologically and psychiatrically, it's always better if MCQs needs a preparation, it should be done like this. Rather than sitting from morning till night and exhausting yourself, and then you won't be able to grip actually the MCQ. Maybe और MCQs में रट्टा लगा के थोड़ा मुश्किल हो जाता है. So this is important factor. Mass practice should be avoided. Spaced practice preparation is always preferred. And don't psych yourself out. Don't burn out yourself. A certain amount of anxiety is normal. Relaxation training, you should be able to do that, and less stressful environment. So if your boss is nasty and keeps you busy and keep you going during the day, fine, don't practice the MCQs there, then come back home and then find time out, and always make sure that you should go for a spaced practice of MCQs. So घर आते हुए रास्ते में, रास्ते से घर पहुंच के, फिर लंच करके, फिर थोड़ी देर बैठ के, फिर उठ के, फिर थोड़ा सा वॉक करके, फिर ताकि focused of mind and attention should be there, and you will be able to understand the theme rather than just rote learning. Because rote learning MCQs, you won't be able to attempt too many of them. If you really have to attempt good number of MCQs, then you have to make sure that it should be spaced out. Okay, I hope it makes sense. If there is any questions, please let me know. You can stop me. Where am I? Okay, you can stop me and you can ask me. And Benazir is here, Manur is here, so you can just let me know. Okay, now the first and the foremost thing that I always want you people who are appearing in IMM or FCPS Part 2 MCQ examination. So FCPS Part 2 का भी notification नहीं आया, but I'm sure that soon it will be announced as well. So the first and foremost thing is that all of you should go to your supervisors. And most of your supervisors are the examiners as well. CPSP has published a booklet where they give us table of specification for the candidate. It contains whole bunch of the things. We don't want that. Again, for MCQs, that is one guideline. Yes, उसमें chapter लिखे हुए हैं, उसमें headings लिखी हुई हैं, और उसमें चीजें mention हैं, which is a good thing. But your examiner again understands the other side of the story. So as examiner, the table of specification is a little bit different. In a sense, it is always clearly mentioned that examiner going, I'm sorry, disturbance हो रही है. Can somebody mute them? Okay. So examination में जब when an examiner is going to make a paper, they are given a table of specifications in a sense that they know that they have to make 5 MCQs from schizophrenia, 5 MCQs from phenomenology, 5 MCQs from psychopharmacology, 5 MCQs from therapeutics, 5 MCQs from medical and other associated specialities and psychiatry. So all of you have to go back to the supervisors and ask them, what is the table of specifications of the examiner? I don't think so it's unethical or illegal to just let you know that these 100 MCQs will be 5 from each from these topics. This is just, again, to make you understand that these are the areas that you need to focus. So so therapeutics, 5 questions. Now, you have to make sure that you should be able to cover that area of therapeutics and able to attempt 5 of those questions. Same goes for other headings as well. So if your supervisor can lead you for this, that is ideal. If not, then we'll go to the official table of specification of CPSP, which is again showing a heading, main heading, like you are supposed to cover therapeutics. In therapeutics, you are supposed to cover the introduction, you are supposed to cover the neuropsychopharmacology, steady states, half-lives, blah, blah, blah. So was detailed, structured cheese available. Now, that table of specification which the examiner knows that 5 questions from this section, 5 questions on this section, and 5 questions on this section is much more helpful for the candidates. But if you don't know that, then you have to rely on the general table of specification. Then you have to go the way I'll be teaching you now. So chapter. So if supposedly there is a chapter of schizophrenia, there is a heading of differential diagnosis, heading, differential diagnosis. And then you will try to gather all the MCQs which are related to differential diagnosis of schizophrenia. So what I recommend is, people ask me what kind of book we should read for MCQs. So first, again, you have to read schizophrenia as a whole. वो किताब को तो आपको पढ़ना पड़ेगा पूरा, इसलिए वो थोड़ी सी डेप्थ ज्यादा हो जाएगी. अगर सिर्फ आपने एमसीक्यू से फोकस करना है, सारी चीजें कवर नहीं होंगी. सो आप पूरा स्किज़ोफ्रेनिया पढ़ लें. फिर स्किज़ोफ्रेनिया के डिफरेंशियल डायग्नोसिस के जितने एमसीक्यूज हैं उनका एक पूल अलग कर लें. कुछ मार्केट में देयर आर बुक्स अवेलेबल which are books are able to give you like this. The MCQs are related to differential.
Professor sir, please unmute yourself.
अनम्यूट कर लें. सॉरी, मैंने गलती से म्यूट कर दिया. As usual.
Okay, कितनी देर पहले म्यूट किया?
1 मिनट, कुछ सेकंड.
Good seconds. That's okay then. Okay, so you have to again select the chapter, then the heading like etiology of schizophrenia, then all MCQs related to etiology of schizophrenia. So you will get the table of specification of CPSP, then you will see all the chapters, then the headings, and heading wise you will select the MCQs. So you will read chapter schizophrenia from a textbook, then you will get the heading of differential diagnosis. किताब आपने पढ़ी है, differential diagnosis के MCQs सारे आप डिटेल से फिर आप attempt करेंगे. That is the ideal way of going forward, right? But again, because of the shortage of the time and the busy schedule, you may not be able to go for like this. But if you get a book which gives headings and the MCQs, that is the best book, if you ask me. So मैंने एक बिहेवियरल साइंसेस की किताब लिखी तो मैंने उसमें उसी हेडिंग्स के हिसाब से MCQs डाले. It's still available, and probably soon we may be able to send you a copy of each, and I will tell you soon what to do about it. So the MCQs should not be attempted like one go and everything. It should be learned according to the chapters and the headings, and only then the MCQs would make sense to you. अगर आप ऐसे एक MCQ की किताब पढ़ के उसको अटेम्प्ट करते चले जाएंगे, you will be lost soon, and then you will forget. So rote learning will fail, and you will fail. So always remember, read the chapter, read the heading, get the MCQs, and perform them. Then it is the best way to do it. Attempting an MCQ, as I mentioned to you earlier as well, look over the test and pace yourself. So if you know that you have to attempt in a question paper 100 MCQs in say 3 hours, divide the time per MCQs. कितना बनेंगे? 6 3s are 18, 180 minutes for 100 MCQs, which means approximately 1.5 minutes per MCQ. This is too less. Okay, 1.5 minute में क्वेश्चन अटेम्प्ट करना मुश्किल होता है. So इतना reasonable एग्जाम नहीं होता. But I'm just giving you an example. So if you have to attempt 100 MCQs and if you are given 3 hours, then per MCQ, you have 1.5 minutes. And if you delay it, then you won't be able to complete it. And if you won't be able to complete it, the possibility of the failure is high. So make sure that you know that this much time is per MCQ with you. And if you have that time, it's good. If you don't have that time, then it's gone. Take short breaks. As I was mentioning it in the earlier as well. So make sure that don't mass practice MCQs. Try to do MCQs in short breaks. First, choose a chapter, choose the heading, then MCQs related to it, and of course, with short breaks, so that you are able to understand rather than just rote learning. Don't skip around. So you will say, okay, fine, this is schizophrenia. So I know schizophrenia reasonably well, so I can just leave it and I will do it later on. Don't do that as well. Once you have started a chapter, once you have started a heading, try to complete it from zero to end. Otherwise, again, you won't be able to attempt an MCQ. So attempting an MCQ is an art. If you are good in that art, you will pass. If you won't be good in that art, you will fail. Always understand, these are the basic rules of attempting an MCQ. Don't be afraid to change your test answer, first answer. Now, this is again a very, very tricky thing. So I see it and then I analyze it and then I try to respond to it. And then I feel, okay, no, probably this is not a good answer. So probably this second one is more better than the first one. And I change it and I may make a mistake. If you're really preparing yourself the way I am telling you, right? 5 principles I have given you: space practice, chapters, heading, all MCQs in that heading, attempt them one by one. Finish that job and then move forward. Go slow, be precise, make sure that you understand rather than you just rote learn it. And if you have understanding, and so the first click on an MCQ when you read it is usually 90% accurate. Subsequently, if you are confused, then this means that there is a possibility of making a mistake. So try not to change too much, right? This is again an important parameter. What to do if more than one answer seems to correct? Common theme, common problem. Ask yourself whether the answer you are considering completely addresses the question. If the test answer is only partly true or is true only under certain narrow conditions, then it's probably not the right answer. So reading a STEM and then you feel that out of these two, this seems to be better attempt because it makes sense, because it covers the whole of the domain asked in the STEM. If that is true, then that is right. If that STEM is not covering whole of the responses in the STEM, then probably it's a wrong answer. If you have to make a significant assumption in order for the answer to be true, ask yourself whether this assumption is obvious enough that the instructor would expect everyone to make it. If not, dump the answer and just overboard. So the thing that I'm trying to say is intuition along with the knowledge makes sense. Only intuition will end up you in a deadly situation. So intuition mixed up with the knowledge is the best option. So don't make irrelevant choices. Okay,
Sir,
G.
I wanted to add one thing that, when I was attempting exam question paper for the MCQs, so there was this question, for instance, what is the treatment option for post-traumatic stress disorder? So two of the options were right. And I was 100% sure because I had read them. according to the guidelines. What to do in those cases in which two of the options are correct? Now that's
Okay.
very
Now
yeah.
again, two options cannot be correct as far as the exam is concerned. They have to give one best option. And if you feel that the two of the options, both options seems to be 100% correct, like one MCQ was attempted from, say, board series papers, and one MCQ, similar MCQ, was attempted from other area, and you feel that one was saying PTSD, another was saying bipolar, and both was okay, you have to make again a judgment call. Two attempts cannot be possibly true, so you have to choose one of them. So the one which is broader, one which is covering the whole of the area, one which is covering whole of the stem is the better answer. One which is covering only the part of the stem or part of the question or part of the process is wrong. So then again, making a choice is absolutely clear. You see that nowadays, when their ideal MCQ is ideal MCQ, मैं अभी उसके बारे में आता हूँ आगे attempt करने के लिए, वो भी मैं बताता हूँ. So ideal MCQ considers every 5 options to be the same. They all seems relevant. Ideal MCQ stem की explanation के लिए पांचों stems ठीक आंसर दे रही हैं, पांचों ठीक हैं, लेकिन पांचों में से बेस्ट ऑप्शन कौन सी है? वो ऑप्शन जो टॉपिक कवर कर रही है, ब्रॉड है, हर चीज के अंदर समा रही है और हर चीज कवर हो रही है. दैट इज द बेस्ट ऑप्शन. सो अगेन वी विल टॉक अबाउट इट अ लिटिल बिट मोर. इफ यू सस्पेक्ट दैट अ क्वेश्चन इज अ ट्रिक आइटम बाय most of the candidates believe कि जरूर कोई चक्कर है. No, that's actually not the situation. कोई ऐसा चक्कर नहीं होता एग्जाम में. Make sure you are not reading too much into the question and try, sorry, it's okay, and try to avoid imagining detailed scenarios in which the answer could be true. So if you read a stem and then you feel that these two stems are correct and I should choose this one because this one seems to be making a sense and the other one is probably a trick, then you choose the a trick item is actually kicked out from your mind and you pick up the wrong answer. Again, make sure that too much thinking, अच्छा ये हो गया तो फिर ये होगा तो इस तरह करेंगे तो ये कर देंगे, इस तरह करके तो इस तरह हो जाएगा, तो इसको मैं इस तरह अटेम्प्ट करूं तो शायद एग्जामिनर राजी हो जाएगा क्योंकि एग्जामिनर ने इधर चक्कर देने की कोशिश की है. नो एग्जामिनर or no MCQ actually is accepted if there is a trick in it. So usually in every MCQ, it's straightforward. 5 options, all options are correct, but one option is the best, which is covering the whole of the topic, whole of the area, whole of the subject, whole of the stem. That is correct. One which is covering only some part of it, leave it. That is not the truth. So trick questions are only tricky because they are not taken at the face value. So you start thinking, इतना सादा जवाब नहीं हो सकता इसका, इसमें कुछ चक्कर है. कोई चक्कर नहीं. जो चीज नजर आ रही है, that is true. Fine. There is no tricks in the exam. What to do if more than one answer seems to be correct? What Benazir asked. If after your very best effort, you cannot choose between two alternatives, try vividly imagining each one as the correct answer. If you are like most people, you will often feel, now that comes the intuition, feel that one of the answer is wrong. Trust this feeling. Research suggests that feelings are frequently accessible even when recall is poor. For example, we can still know how we feel about a person even if we can't remember the person's name. Although this tip is not infallible, many students find it useful. जहां पे बिल्कुल डेड एंड आ जाए कि ये दोनों ऑप्शंस ठीक हैं, then वहां पे use your imagination and go for it. But again, imagination and intuition should be the last resort. Always trust yourself. No tricks, nothing. Okay, moving forward. The guessing factor. Now, this is another if and but this is true. The guessing factor reduces reliability of multiple choice item scores somewhat, but increasing the number of items on the test offsets this reduction in reliability. The following table illustrates this principle. Now, this is all science. I'm not talking anything from my own end. I'm talking from the references, right? So number 4, alternate multiple items on test. Chance of scoring 70% or high by blind guessing alone. So out of 2, there is 1 out of 16% chance that you are right. 5, 1 out of 64. 10, 1 out of 285. 15, 8,670. 20 and 25. Now, there are few questions where you can put a wild guess. But the number of the questions that are increasing, where you are making the wild guess, the possibility of getting correct answer out of them reduces significantly. So if out of 100, 25 of the questions you have attempted with the guess, the possibility is 1 out of 9,42,651 that your answer is correct. So guessing blindly, on one hand, yes, can lead you somewhere, but most chances are that you will fail. So don't guess. The more the guess is, the worse is the outcome. So guessing is actually a tricky problem. Now, how the examiner make an MCQ? I will be just going for a few more slides on it, and then we will try to talk more about related topics. Okay, like anatomy of multiple choice questions. I'm just picking this picture from somewhere, so the names are again Gora names, so don't bother about it. Deb has a board that measures 5 feet in length. How many 1/4 foot long pieces can Deb cut from the board? A 1, B 9, C 10, D 20. Right? 1/4 5 feet है और 1/4 फुट काटना है, कितने टुकड़े कटेंगे? 4 ऑप्शंस हैं या 5 ऑप्शंस हैं, 3 डिस्ट्रैक्टर्स हैं, 1 करेक्ट है. So all are figures now. 1, 9, 10, 20. They are all figures. And they are all called distractors. And 1 is the correct answer. So options, distractors, correct answer. This is basically the anatomy of an MCQ. Example and parts of a multiple choice item. So there is a stem of a question. What is chiefly responsible for the increase in the average length of life in the USA during the last 50 years? So this is a stem, open stem. Distractor, compulsory health and physical education courses in public schools. Answer, the reduced death rate among infants and young children. Distractor, the safety movement which has greatly reduced the number of deaths from accidents. Distractor, the substitutions of machines for human labor. Now, if you broadly look at the answer, all 4 of them seems correct. पिछले 50 सालों में यूएसए में डेथ रेट कम क्यों हो गया? 100 मशीनें ज्यादा आ गई, ह्यूमन फैक्टर कम हो गया, सेफ्टी ज्यादा बढ़ गई, ठीक है, और कंपलसरी हेल्थ और एजुकेशन सिस्टम बेशुमार इंट्रोड्यूस कराए गए. सो प्राइमरी प्रिवेंशन पे जोर ज्यादा दिया गया, बट इनमें से कोई रीजन भी करेक्ट नहीं है. साइंटिफिकली प्रूवन द reduced death rate among infants and young children make actually population go up. So increase in the average length of life. Average length of life is coordinating with reduced death rate in infants and adolescents. तभी average बढ़ेगी. अगर बच्चा पैदा होते ही मर जाता है, 3 साल की उम्र तक मर जाता है, 10 साल की उम्र तक मर जाता है, तो एवरेज लेंथ ऑफ लाइफ नहीं बढ़ेगी, क्योंकि सिर्फ एक खास पोर्शन ऊपर जा रही। सो वो एक रैशनल अडॉप्ट किया जा रहा है। आइडियली द आइटम शुड बी आंसरेबल विदाउट ऑल ऑफ द ऑप्शन बीइंग रेड। आइडियली मुझे जब मैंने स्टेम पढ़ी तो मुझे उसी वक्त पता होना चाहिए था द रिड्यूस्ड डेथ रेट अमंग इन्फेंट्स एंड यंग चिल्ड्रन विल इंक्रीज द लेंथ ऑफ लाइफ actually in any other given situation. This is ideal, but of course we don't need ideal. We need science and we need data and we need rationalization. So बाकी सारी rationalization irrelevant है। फिर आज नींद न्याजी का दिन है, कुछ उंज भी रावां औखियां सन, कुछ गल विच गम दा तौक भी सी, कुछ शहर दे लोग भी जालिम सन, कुछ सानू मरन दा शौक भी सी। So if you wish to die, try to give both MRC Psych Part 1 and IMM exam, and I'm sure that you will definitely, in one of the places, you will be in a doomsday. So be careful about the distraction. Don't go for it if you don't need them. 10 rules of developing multiple choice questions. Now, these are the 10 rules that I'll be just reading and I'm sure that you'll be able to understand them. This is how the examiner is supposed to make an MCQ. And if you know them, it will be easier for you to attempt. Rule number 1, test comprehension and critical thinking, not just the recall. पहला जोर ये दिया जाता है MCQ में कि जी रट्टा नहीं होना चाहिए, ठीक है? सो रट्टे को अवॉइड करें, आप critical analysis और critical thinking को promote करें. Go beyond recall by asking learners to interpret facts, evaluate situations, explain cause and effect, make inferences, and predict results. Rule number 9, use simple sentences, structure, and precise wording. Tricky सवाल नहीं बनाने, सीधे सीधे बनाने. Write test questions in a simple structure that is easy to understand, and try to be as accurate as possible in your word choices. Words can have many meanings depending on colloquial usage and context. What is implied? We must create the correct perception or mental image in the question design students will read. What is reality? And the reality should be evident in the STEM. Ideally speaking, this is the focus given to all the people who are making the MCQs. Make sure the words are simple, understandable, they are factual, they actually are precise, and there is no trick in it. So no tricks. Rule number 3, place most of the words in the question stem. So answer में, STEM में जो है, उसमें आमतौर पे लंबे लंबी लाइनें नहीं होती, ठीक है? अगर लंबी लंबी लाइनें हैं तो अच्छा MCQ नहीं है. सो लंबी लाइनें स्टेम में और छोटे छोटे आंसर जो हैं वो आंसर नीचे. A STEM is the section of a multiple choice item that poses the problem that the students must answer. STEMs can be in the form of a question or an incomplete sentence. If you are using a question stem rather than an entire question, ensure that most of the words are in the stem. The answer options can be short, making them less confusing and more legible. Okay, so there are 54 apples set aside as a snack for a class of students, 3 classes of students. The teachers divided up the plates and placed equal amounts on 9 separate trays. If each of the 3 classes received the same number of the trays, how many apples did each class get? Any problems in answering this question? 54, 3, and 9. You calculate, you respond, 18 per class, 54, right? इसमें कोई मुश्किल है नहीं वैसे, आई होप के. फिर अगेन मुनीर नियाजी साहब कहते हैं कि मोहब्बत अब नहीं होगी, सितारे जो दमकते हैं किसी की चश्मे हैरा में, मुलाकातें जो होती हैं जमाले अब्रों या बारां में, ये ना आबाद वक्तों में दिले नाशाद में होगी, मोहब्बत अब नहीं होगी, ये कुछ दिन बाद में होगी, गुजर जाएंगे जब ये दिन. ये उनकी याद में होगी, मोहब्बत अब नहीं होगी, ये कुछ दिन बाद में होगी. Okay, rule number 4, make all distractors plausible. So 5 उसके ऑप्शन हैं, 5 में से 4 डिस्ट्रैक्टर्स हैं. सारों के आंसर्स एक्चुअली मिलते जुलते हैं, ठीक लगते हैं. All of the wrong answer choices should be completely reasonable and based on the state standards. Avoid throwing in those giveaway distractors as it is distracts from the test of validity. So इस प्लेट में 4 संतरे, 12 माल्टे, 3 किन्नू, 2 आम और 1 केला है. Again, don't give irrelevant, stupid statements in the distractors. The examiners are always asked not to do that. So you have to understand that as well. Avoid answer choices, I do not know, or I was never taught this material. It distracts from the analysis of the assessment and the measures of the knowledge to the standards. So there is nothing out of the course. Everything is part of the course. So you cannot challenge CPSP. The question number 17 was out of course because everything is the course, whatever comes in the exams. Keep all the answer choices in the same length. Usually one question lengthier to second question shorter is again a bad option. This can be difficult to achieve, but expert test takers can use answers length as a hint to correct the answer. Often the longest answer is the correct one, if getting all. So if the statement is 4 or 5 stems, and one of them is the biggest one, the chances of getting, so guesswork, chances of getting this one is the right answer is probably most high. So you won't have any problems with it. 4 answers to the same length is difficult, then try using 2 short and 2 long sentences so that the people can get confused. If all of them are short and one of them is lengthy, possibility that is the correct answer. Avoid double negatives. Don't use combination of the words in the same question. Not, no, nor, the un, prefix, etc. For example, this is the type of the question that could confuse test takers. Which of the following are the appropriate answer to the question? 1, 2, 3, 4, 5. ऐसे questions जो हैं अब avoid किए जाते हैं. So अच्छा MCQ never starts in which of the following statement is correct. Comments would not be unwelcome in a work situation. Flip it around and write it in the positive form. Which of the following comments are acceptable in a work situation? So that is another. Mix up the orders of the correct answer. So examiner जब MCQ बना लेता है, उसके correct answers 1, 2, 3, 4 बन जाते हैं, तो फिर उसको वो shuffle किया जाता है. CPSP में I don't know, but ये formula है कि नहीं, but rest of the places, this is the formula. They shuffle the answers, correct answers, and the sequence given by the examiner is usually shuffled around. So A is turned into B, B is turned into E, E is turned into A. So इस तरह वो shuffle कर देते हैं और random position पे correct answer रखा जाता है. So एक examiner आप जब MCQ बना के भेजता है तो वो usually सारे C में true हो गए. So that is again a problem. So आपके उसमें केस में ये इतना मैटर नहीं करती. Keep the numbers of the option consistent. So 5 out of 1 best option. So 5 are the options and you have to choose the one, and all the paper are like this. Avoid tricking test takers. So no tricks. ये बात मैं पहले कर चुका हूँ इसलिए मैं इस पे फोकस नहीं कर रहा. अच्छा ये मैं बाद में पढ़ता हूँ. आखिरी rule number 10, use all of the above and none of the above. Now none of the MCQ will be showing you these things, all of the above or none of the above. This was long time ago, 20 years ago, when I started making an MCQ. I used to make like things like this, all of the above, none of the above. Now the data shows that this is not actually a good MCQ. So usually these questions are taken away from the MCQ actually question sheet. So the examiner has to focus on distractors and quality of distractors, not just the all of the above or none of the above. Okay, so I think दिस इज गुड. ओके, ये मैं बाद में पढ़ देता हूँ. एनी क्वेश्चन सो फार? यू पीपल वांट मी टू रिस्पॉन्ड? चैट बॉक्स में कुछ नहीं है. ओके, फिर मैं ये पढ़ देता हूँ कि इतनी देर में आप लोग सवाल सोच लो. हमेशा देर कर देता हूँ, जरूरी बात कहनी हो, कोई वादा निभाना हो, इसे आवाज देनी हो, इसे वापस बुलाना हो, हमेशा देर कर देता हूँ मैं. मदद करनी हो इसकी, यार की ढारस बंधाना हो, बहुत देरीना रस्तों पर किसी से मिलने जाना हो, हमेशा देर कर देता हूँ मैं. बदलते मौसमों की सैर में दिल को लगाना हो, किसी को याद रखना हो, किसी को भूल जाना हो, हमेशा देर कर देता हूँ. एनी क्वेश्चन? एनीबडी? नोबडी? सब समझ आ गई है? कुछ समझ नहीं आई?
सर कोई सॉरी सर, कोई स्पेसिफिक एमसीक्यू की बुक जो आप रिकमेंड करें फॉर आईएमएम कैंडिडेट्स?
Honestly speaking, I told you earlier that एनी बुक, मेरा मशवरा अगर पर्सनली मुझसे पूछो तो मैं ये कहूँगा कि आप वन बेस्ट ऑप्शंस वाली जो एक किताब मैंने भी शेयर की थी पीडीएफ में, वो मुझे अच्छी इसलिए लगी कि उसमें वन बेस्ट ऑप्शंस मुख्तलिफ जगहों पर प्रेजेंट किए गए थे. सो मुख्तलिफ जगहों के प्रेजेंट वो टेस्ट पेपर्स थे जिनको इकट्ठा किया गया. सो दैट वाज नॉट अ बैड ऑप्शन. आपको चाहिए ये, जैसे मैंने शुरू की थी प्रेजेंटेशन, कि अभी आपके पास टाइम है 4 महीने, आप किताबें इकट्ठी कर लें एमसीक्यूज की, और फिर जैसे मैंने पहले बात की है, थीम सेलेक्ट करें, चैप्टर सेलेक्ट करें, फिर क्वेश्चंस उससे रिलेटेड सारे एमसीक्यूज उधर अटैच कर लें. सो उनको सम अप कर लें. आपको जैसे न्यूरोबायोलॉजी है, ठीक है, न्यूरोबायोलॉजी पे क्वेश्चंस आते हैं, आईएमएम में खास तौर पे आते हैं, ठीक है. न्यूरोबायोलॉजी के क्वेश्चंस को जहां जहां से भी, जिस जिस किताब से भी मिलते हैं, किसी एक जगह पे इकट्ठा कर लो, और जब न्यूरोबायोलॉजी का चैप्टर पढ़ो तो उसके सारे एमसीक्यूज अटेम्प्ट कर लो. दैट इज द बेस्ट ऑप्शन. कोई एक किताब भी 100% सारे एमसीक्यूज कवर नहीं करेगी, क्योंकि आपको नहीं पता कि एग्जामिनर ने कहां से चोरी किया है. So that is variable as well. So I feel that if you have time, select the chapter, select the topic, gather as many MCQs related to this topic, and then attempt them. Ideal way. If not, कोई भी किताब उठा लो, MCQs वन बेस्ट ऑप्शन का चाहिए, और क्लिनिकल सिनेरियोज वाले रिलेटिवली बेहतर ऑप्शन है जो कि यूएस बेस्ड है. और बात फिर वो ये यूएस बेस्ड के एमसीक्यूज बहुत उनकी हाई रेटिंग है, एंड द ओनली रीजन फॉर दैट इज बिकॉज अगेन वो बहुत पैसा खर्च करते हैं इन कामों में, राइट? ओके, एनी अदर क्वेश्चन?
ओके सर, थैंक यू सो मच सर.
You're welcome. I hope this was actually helpful to you people.